The province that was hit hardest at the beginning of the pandemic is continuing the trend. Quebec adding 637 new cases today. It's the highest Quebec has seen since May. The province has now surpassed 70,000 total cases. Ontario also seeing a large number of cases, with 409 continuing its week-long trend. Manitoba has added 54 new cases, while Saskatchewan has 11 new cases. New Brunswick has also added cases. It pushes Canada's total over 150,000. And with a steady surge in cases in Ontario, the province is imposing new restrictions on restaurants and bars. Premier Doug Ford says the crackdown begins this weekend.
All bars and restaurants will be only permitted to remain open until midnight. All adult entertainment clubs will be closed right across the province. All businesses and organizations will be required to implement screening procedures for their workers. And tomorrow, going forward, restaurant and bars must stop serving alcohol at 11 p.m. and close their establishments by midnight.
Ontario nightlife is getting reined in. Starting tomorrow, restaurants won't be allowed to sell alcohol past 11 p.m. and strip clubs are ordered to close. The latest restrictions come with province marking 409 new COVID-19 infections. Is this a response to the second wave? CTV News infectious disease specialist Dr. Abdu Sharkawy joins me now to weigh in on the newest measures. Doctor, always nice to see you. Thanks for being there, because I know you're a busy man. But are these newest restrictions that you heard the Premier, are they sufficient, and will they help?
Well, they'll certainly help. I think it goes without saying that when you're talking about bars and you're talking about strip clubs, where the nature of human activity suggests people will be in close proximity to each other and inhibitions will be lowered, it's always a good thing if we're going to curtail that. I question, frankly, whether it is sufficient. Certainly with respect to bars and serving of alcohol, cutting off the time a little bit earlier. Who's to say that people simply won't compensate for that by getting in their last round a little bit earlier? So personally, I'm not convinced that this will be a sufficient measure to address the problem. We're not really sure that indoor dining or serving of alcohol past a certain period of time is responsible for driving this pandemic. I think what we've become keenly aware of is the fact that we have a very difficult time tracking cases and identifying cases with the testing capacity that is lagging behind the demand. And that's something that needs to be fundamentally addressed. Everything else will help, but it's certainly not going to be sufficient.
Dr. Sharkawy, you say this is not sufficient. So would you, if you were advising the Premier, would you advise for a lockdown, another lockdown here in Ontario? Do those numbers warrant something much bigger than just closing bars and strip clubs?
Well, I hesitate to use the term full lockdown. I think that carries with it an enormous amount of pressure and collateral damage. So I don't want to impose that on our communities again and have everybody go through the same degree of loss and serious distress that we went through in the spring. That being said, I think we need very, very strict about where we are going with this in terms of setting very strict guidelines with respect to what is acceptable, what is essential, what's not essential. We can't keep giving arbitrary limits of 10 people, 25 people inside and outside. I think we have to tell people to really reserve their activities for what's absolutely essential and nothing more than that.
Dr. Abdu Sharkawy, unfortunately, that's all the time we have. Thank you so much, and have yourself a nice, safe weekend, sir.
Thank you, Joyce. Stay safe.